We're going to get started. Hello and welcome to the webinar, Engaging Inuit Youth Around Sexually Transmitted and Blood-Borne Infections. My name is Laura Bouchard, and I'll be your webinar moderator for today. Before I hand it over to our presenters, I have just a few housekeeping items to go over. This webinar is being offered by the Canadian Public Health Association. Our office is located on the original unceded territory of the Algonquin and Anishinaabe people. They've been the guardians of this land for millennia, and CPHA is grateful for the example their stewardship provides. This webinar is being provided as part of a webinar series that we've been hosting over the last several months, focused on the reduction of stigma associated with sexually transmitted and blood-borne infections. For more information on this webinar series, including links to past webinars, can be found on CPHA's website at the link provided on the screen. You can also connect with me if you'd like further information on the webinar series. So that link, I believe, is actually at the end of the webinar. So hopefully you can hear me through either a headset or the speakers on your computer. Due to the number of participants, we've disabled everyone's microphone. And while we'll certainly have some time at the end of the session for questions, we simply ask that you use the chat box to the right of your screen to pose your questions to today's presenters. And I'll be giving those questions to the presenters at the end of the webinar. Can folks hear me okay? Could you type in yes if you can hear? Okay, so if you are having troubles with your audio, I recommend you just log out and log back into the Adobe Connect platform, because sometimes if your microphone is connected after logging in, it doesn't quite work. So for those having issues, if you're still having issues, feel free to send me a message in the chat box, and I'll help you figure that out. So lastly, before we begin, just a quick note that today's session will be recorded and made available on CPHA's YouTube channel in the coming weeks. So today we're going to hear from Sipporah, Enuaraq, and Rebecca Rolfe. I'll provide you with a brief bio for both of our presenters and then hand it over to them. Sipporah, Senior Project Coordinator, has been with Pauktuutit, Inuit Women of Canada, since December 2005, where she started as the coordinator of abuse issues. Sipporah has a strong desire to help make a difference for the lives of Inuit women and children. Sipporah has been working as a coordinator at Pauktuutit's Health Department since June 2014. Sipporah's professional commitment is to be a part of a process that makes a difference on issues and improving the services, programs, and projects that are in existence today. Rebecca joined Pauktuutit in 2018 as a project coordinator and works across both the health and socioeconomic departments. Rebecca is passionate about supporting young people to achieve their goals and has worked with youth as a mentor with a life promotion program for girls in Northern Ontario and program coordinator and facilitator for a skills development educational focus program. Rebecca is currently the lead at Pauktuutit on the Check Up project. So with that, I'll pass things over to Sipporah and Rachel for today's webinar. And Rebecca for today's webinar.
Yes. Thank you very much, Laura. It's a pleasure to be here. Like Rebecca was saying, I'm the senior project coordinator with Pauktuutit. So I will start the presentation now. Just to give you a little bit of background about Pauktuutit, Pauktuutit is a national non-profit organization. We work with Inuit in the 4 Inuit regions. The first on the left is Inuit, which is the NWT, and also in Nunavut, which is Central Arctic, and also Nunavut, which is Labrador, and also Nunavik, which is Northern Quebec. So we work with all the Inuit communities across Canada, as well as urban centers. And today I will be talking about the TEVA, our Naturally Curious project. This project started off under the direction of our sexual health strategy, which we formed in 2017. And we have 6 priorities within the sexual health strategy. The first one is to enhance Inuit sexual health education. And the second one is to address substance abuse and high-risk behaviors, and also to reduce violence, sexual violence, and also to prevent STBBIs. and also to strengthen mental health and trauma-informed supports. And the last one being enhance Inuit-specific research and surveillance. So this is what guides their work in sexual health. And so going into the engaging Inuit youth to talk about sexual health, the objective of the project was to encourage Inuit adults to talk about to Inuit youth about STBBIs, and also to normalize the conversations among Inuit youth about sexual health, and also to promote awareness and prevention of STBBIs, and to encourage Inuit to be tested for STBBIs. Because talking about sexual health has been largely taboo between parents and the Inuit youth. We want to, like I was saying, normalize the conversation about to talk about sexual health. So when we started this project, we had the Naturally Curious project that had two phases. In the first phase, we started off doing surveys to talk to the Inuit communities to know what they know about sexual health. And we went to the three regions. And unfortunately, when we were doing the surveys, we were not able to visit Nunavut. We only went to Nunavut and WT, and also Nunavik. And so we spoke to Inuit youth and adults, and in total we spoke to 132 Inuit youth and adults about sexual health. And we wanted to get an idea as to what the issues were in the Inuit communities. And within the adults, the highest range of adults said that they that it was very personal to talk about sexual health, and even though they were adults, they were shy about talking about sexual health, and it was and in regards to the youth component, they too were shy to talk about sexual health, and they didn't know who to talk to about sexual health, and because the previous generation did not talk about sexual health, they had to learn from start as to how they can start talking about sexual health. I know when I was a youth, I was not able to talk to my parents about sexual health. So with that in mind, we knew that it was still the case in a lot of the regions. And we wanted to encourage the youth to start talking about sexual health, because and also to get tested for sexual health. And so during the surveys, we asked them what they were comfortable in talking about. And so when we spoke to adults about sexual health, the first one, the highest number of issues that they wanted to talk about was healthy relationships, and also self-esteem and self-care. That was very high on the list, and also pregnancy and birth control. And when we spoke to the youth about sexual health, that high on the list was healthy relationships, and also self-esteem and self-care, and also STBBIs. So healthy relationships played a big role in talking about sexual health. And also we were talking about what are the barriers to get testing, and when we spoke to the youth about the barriers, and the Inuit communities are very small. In some communities, there's only about 100 people in one community. So confidentiality was a big issue. And so if a young person wanted to get tested, for instance, if they went to the health center, it might be their aunt who's working there. And also it might be their neighbor who works there. And in small communities, people know everybody else. And so the young people were very fearful of gossip, how they will be talked about within the community. And also they didn't think that they needed to get tested for STBBIs because if you feel fine, you think you are fine, so you don't think of getting tested. And they didn't know how they would go about getting tested. And also communication, that was a very big issue. With communication, when we spoke to adults, what was the best way to talk to communicate with adults within the community? The very thing that was very popular within the adults was using the radio, because in the Inuit communities, the radio is very widely used, and so that was one of their biggest communication tool within the communities. And also they thought that presentations were highly effective. And also going to events, we can share a lot of issues by just going to events, holding health fairs, stuff like that. And they thought that was very effective. And in regards to youth, when we asked them that same question, they said that getting information about sexual health, they can get that in school. And also presentations and events. So that was very similar to the adults, but the difference was with the adults, it was mostly public information type thing, and also with the youth, it was more in a confidential setting, like in a school. And also, when we asked what the youth want to talk about, they said that who do you want to go to seek for answers? And the number one thing that they said was to go see a nurse or a doctor. And also parents and also friends, they talk among themselves about sexual health. And also going on to the next phase, after we got all that information from the surveys from the communities, we went on to the next phase, and that was being informed by the communities that we would come up with a resource development plan. And the project that we worked on, we called it Naturally Curious. And we wanted to use humor to get the information. The young people have indicated that they don't want to see very graphic images of STBIs and stuff like that. And also based on the findings from the survey, we wanted to do visual reference in regards to what's real life like in the North, and also to be appreciative of the Inuit culture. And also we have to be very flexible to accommodate Inuktitut and or English text, because Inuktitut is very strong in Nunavut, but not as strong as in the other regions of the NWT and also Nunavut. So we have to make sure that the information that we developed are in the language that the regions prefer. And so with the resources, we did quite a few number of ways to do it. The first one was we did an information booklet, and also and also the PowerPoint presentation, and also YouTube videos, and also we did a presentation guide, a radio guide that they can use in the social media. And these are tools that we develop for people in the front line, like community health representatives, that they can use as tools, or the schools can use those as tools. And so the information booklet has all the information that we have developed are in very plain language, and we don't use very technical words. And for the, like I was saying, we get to the root of things. When we talk about penis, we say penis and vagina and anus, and we don't say just down there, you know, how we used to be. So we want to use the right language. And also the information booklet also gives tips as to how adults can start talking about sexual health. And also there's information about sexually transmitted infections. So those are very basic information, but information that is very useful when it comes to talking about sexual health. And also, like I was saying, the PowerPoint presentation, it is to be used by the frontline workers. The information is there already, but the communities can adapt the information as they see fit within their community. And also, we did some YouTube videos, and also they are available online. And so they have, we developed very short animated videos about the different issues of sexual transmitted infections. And for the radio guide, the CHRs or the frontline workers can use this as they go on the radio, because the communities, you can remember, said the biggest use of information dissemination tools by radio. And so, and also we did social media. I think we have a Naturally Curious Facebook, which is available online. And like I was saying, on the left, you can see images that that we use humor. It's a very hard issue, but we know that we need to talk about it. And if humor works for the youth, then we will use humor to get the information out. And so that has been my presentation about the Naturally Curious project. I will now hand it over to Rebecca Rolfe.
Wonderful. Thanks, Sip. So as mentioned, my name is Rebecca, and I'm going to be speaking about the Checkup Project. So the Checkup Project began in Nunavik and has emerged as an Inuit-specific promising practice focusing on the secondary prevention of STBBIs. This project has proven to effectively engage and empower Inuit youth in Nunavik by encouraging them to practice their agency while engaging with the healthcare system. So to give you some background and some context, in 2013, declaration rates for chlamydia and gonorrhea infections in Nunavik were respectively 9 and 73 times higher than those reported for the province of Quebec. In Nunavut, these rates are over 50 and 14 times the national average. So this knowledge, combined with the inadequate and often understaffed healthcare facilities in the north, high staff turnover, and overworked staff working with limited resources, is obviously of great concern. Additionally, STBBIs are generally highly stigmatized, and testing and/or treatment may be low due to concerns around anonymity in small Inuit communities, as Sipporah has mentioned. It's also important to note that sexuality and sexual health are often not discussed in Inuit families and communities. So in response to this need, the Nunavik Board of Health and Social Services launched the Checkup Project, a communication campaign using social marketing and social media to influence the social norms surrounding screening and the normalization of testing. The Nunavik Board of Health and Social Services, along with 32 Mars, which is a marketing agency specializing in strategy, design, and advertising, conducted needs assessments in 3 communities in Nunavik. So these community needs assessments were done to increase the understanding of the worldview of Inuit youth, particularly the norms and beliefs surrounding love, relationships, and sexual health. Youth were recruited by community stakeholders, such as community health nurses and youth counselors, and participated in individual interviews, group activities, and written questionnaires. So some of the things that came out of the needs assessment included that Inuit youth wanted to see their community leaders be on board with the campaign, as they are seen as role models and perceived as an asset to behavior change. Local nursing stations needed to be involved as well. The entire communications campaign needed to be available in Inuktitut. Men's need for support seemed greater than women's, as men seemed to display more risky behaviors and have a harder time getting tested. The tests themselves needed to be de-dramatized and correct information about the nature of the test shared. And lastly, youth shared that education is a priority in fighting STBBIs. So they want more information on sex, relationships, and STBBIs. So based on what was heard from youth directly during the community needs assessment, 32 Mars developed some funny videos with a musical group called Twin Flames and youth from across Nunavik that feature discussions around STBBIs, testing, sexual health, communication, and relationships. And so now we're going to show you one of the videos that was developed.
I'm just going to pause the video for a brief moment to see if it plays smoother if I allow it to load a little longer.
Hey, it's Yai from Twin Flames.
And Laura, if the video doesn't load, what I can do is just direct people to the Checkup Facebook page because this video is there if you wanted to have a look at it. It's a really awesome video, like I said, where there's some discussions around STBBIs and getting tested, and it's pretty funny as well. So maybe I'll move on, but if people are interested in having a look, you can find it on the Checkup Facebook project page.
Moment. What we can maybe do, Rebecca, is actually send a link directly to the video with the recording for the webinar, just so folks know where to find that when we do our follow-up.
That would be great.
I'll give it one more try just in case it works. Otherwise we'll.
Youth have to say about sexual health and relationships. What youth have to say about sexual health and
Okay, so that's what we'll do then. We'll send out a link afterwards so people can have a look at the video. So as I mentioned, there were some different videos created, and then these videos were shared to the Checkup Project Facebook page. The Facebook page is also used to share educational and humorous content, such as videos, memes, quizzes, and surveys, and infographics. Most of the content on the page has now reached roughly 2,000 youth per post. And 1 year after the page launched, we had about 1,400 subscribers. So now there are over 2,100 followers of the page from all over Nunavik, and the average reach of the post is about 6,000 people. The most recent phase of the project included the creation and launch of Pauktuutit by Checkup Project. So this is a radio show that is available as a podcast that was able to host deeper conversations about STBBIs, sexual health, and relationships. So the first season of the podcast touched on topics that are important to youth, like being yourself, substance use and safe sex, STBBIs and screening, and some others as well. The episodes are available on SoundCloud, the Checkup Facebook project page, iTunes, and Google Play Music. Youth seem to be really enjoying and engaging with the storytelling aspect of the podcast. And so there's going to be a second season of Piotsuva that continues the conversations, but also focuses on sexual health and wellness more broadly. So be on the lookout for that. In addition to the communication and social marketing campaign, the Nunavik Board of Health and Social Services has been collaborating with the health centers to improve access by introducing fast-track screening services, what are being called quick checkups. So these address concerns of nurses for a simple, quick, standardized procedure and the needs of youth for a fast and less embarrassing encounter. These quick checkups are now being offered in every community in the region. So in the first 12 months of the campaign, screening rates in the region increased by 35%, with a significant increase among men and youth in particular. And the ratio of positive tests increased by 28%. So the next steps of the project, Pauktuutit is currently working with the Nunavik Board of Health and Social Services, Enuaraq Regional Corporation, and the University of Saskatchewan to enhance and scale up the project in Nunavik and expand the project to a new region, which is the Enuaraq Settlement Region. This phase of the project will continue conversations around sexual health while moving to a more holistic approach to health, wellness, and harm reduction to create social media content and community-based interventions that promote healing. The broad goals for this phase of the project include normalize testing by changing attitudes and social norms around the use of screening services for STBBIs and reduce the barriers to testing and linkages to care, decrease the burden of STBBIs throughout Inuit Enuaraq, improve wellness and resiliency of Inuit youth using land-based and culture-based methods, contextualize the checkup project in another Inuit region, which, as I've mentioned, is the ISR, and foster Inuit youth leadership in the planning of holistic health promotion interventions. So some of the ways that we'll be engaging Inuit youth in the second phase of the project include, again, community needs and readiness assessments, where Inuit youth will discuss and explore topics like sexual health and wellness, sexuality, attitudes, norms, and behaviors regarding access to care, and barriers and enablers to access care. Youth from the regions will actually be the ones facilitating these learning circles, and then collecting data and giving that feedback to the research team at the University of Saskatchewan. As well, there'll be young researchers involved in the design of the research methodology. And something we're really excited about is holding a few on the land retreats, where youth from the two regions will be able to come together and explore some of the topics while also engaging in both land and culture-based activities. So that is it for me. Thank you very much. And I think that we now have plenty of time for questions because that video unfortunately was unable to play.
Yeah, sorry again about the video. So it looks like Savannah provided the link there in the chat box, but I'll also make sure that link gets included with the follow-up from the webinar. So yeah, we do have lots of time for questions. Thank you so much, Sipporah and Rebecca, for your presentation. It's really great to hear about the exciting work that's being done by Pauktuutit. So yeah, if you do have questions for our presenters, please feel free to type them in the chat box, and we'll go from there. See a few people are typing, so I'll just leave some time for folks to type in their questions. Okay, so we have a question here. how did you assure youth that confidentiality will be maintained in the small communities?
What was the question again?
So the question is, how did you assure youth that confidentiality will be maintained in the small communities? And I'm thinking maybe that might have to do with the research activities, like the scoping that was done prior to kind of in the project planning stages.
Yeah, we stressed about confidentiality everywhere we went to, and they know that in the schools the teachers stress that confidentiality is a very important issue. So I guess it would be a trust issue between the youth and the health centers. I hope that answers the question.
So another question we have here, have you performed another survey to see any results from programs? So any kind of insights and evaluation of the programs that you talked about?
Yeah, so I guess I can talk a little bit about the checkup project. So there was a evaluation done of the social media campaign itself and the impacts. And so what was found through that, I had mentioned briefly during the presentation, and that kind of focused on, engagement on social media. And so there's some, data analytics about engagement. And as well, as I had mentioned, since the campaign began, there was a 35% increase in screening rates. And again, that was particularly among men and youth. And the ratio of positive tests increased by 28%. So I hope that answers that for respect to the checkup project, but I wasn't sure if Sipporah had anything to add.
No.
Okay.
Great, thanks. So then we have another comment here. Thank you for sharing these excellent initiatives. I noticed a lot of the information focuses on biomedical topics, and I wonder if you could share more information about some of the topics of interest around healthy relationships and what initiatives were developed to support youth and adults on those topics.
Sorry, Laura, could you just repeat that question for us?
Sure, sorry. So it's, thank you for sharing these excellent initiatives. I noticed a lot of the information focuses on biomedical topics, and I wonder if you could share more information about some of the topics of interest around healthy relationships and what initiatives were developed to support youth and adults on those topics.
Yeah, I can share again a little bit from the checkup project. And so specifically, I guess, around healthy relationships, there was, some interest around consent, and specifically what consent looks like and how to communicate that. And so on the checkup project Facebook page, I believe that there were, some different media shared with respect to what consent looks like, what that looks like. And again, with respect to the healthy relationships, the podcast actually goes in depth. I think the episodes are about an hour. So there's a lot more time dedicated to these conversations. And again, as I had mentioned, some of those topics included consent. They include substance use and safe sex, being safe with your partner, that sort of stuff. And again, as the second season of the podcast come out, there's going to be a lot more conversations about that.
And I think going back to healthy relationships, I was at a conference recently, and we were talking about young people and how they feel about healthy relationships. Some of the ideology that I had when I was a younger person about relationships. During my misguided youth, I thought if my husband or if my boyfriend was very jealous of me, then I naturally or mistakenly thought that he must be so much in love with me that he's acting like that. I just, like I was mentioning, I went to a conference and we were talking about youth. There's a lot of that same belief that I had, and I thought through education, I thought, and also awareness, I thought that thought of thinking might have changed over the years, but that is a very good indicator that we still need to talk about issues of healthy relationships within the communities.
And I think with this sort of next phase of the checkup project, with the University of Saskatchewan and the other partners that I had mentioned, we are looking to look at sexual health, relationships, STBBIs more broadly, and again, coming from a more holistic approach to health and wellness. So hopefully we'll gather a little bit more information around specifically how young people are feeling about healthy relationships, what sort of things they are interested in, and how to support them.
And it's Sipporah again. What I had wanted to mention when I was doing my presentation, when we were doing our surveys with the Inuit adults, a lot of the people that we were speaking to were elders. And with the use of Inuktitut language, there's some words that we don't have in Inuktitut that we have in English, like oral sex, for example. We don't have a word specific for oral sex. And when we were talking to the Inuit elders, we had to use very descriptive language to talk to them, and it was issues like that. We thought we were not going to be able to communicate properly with the adults, but we were pleasantly surprised that they were very open to answering questions like oral sex, going into descriptive or talking about oral sex.
Great, thanks so much for sharing your responses to that question. There's certainly a lot we can learn. So then we have a few other questions and comments here as well. So Melody is wondering whether there's the option to connect with you if they're interested in kind of following up, or if they think that their work might connect. Would you be okay with us including your contact information in the follow-up, or I'll leave that to you whether that's something you're okay with?
Yeah, absolutely. That would be really wonderful.
Okay. Perfect. So we'll make sure that their contact information gets included on the slides, if not already. And then Joanne is asking, for the social media posts where you use memes, did you need to get permission to use the pictures? For example, a picture from Forrest Gump.
That's a really good question. With respect to the checkup project, we had worked specifically, as I had mentioned, with 32 Mars, and so they are a marketing agency. Who does this type of work, and so I would assume that that they know, but unfortunately, I don't actually have an answer. But I can definitely find out for you, Joanne.
With the Naturally Curious project, we didn't get into that issue because we just used animation, but that's a good question, like Rebecca was saying. Yeah,
and I definitely encourage folks to go check out the Facebook page and websites. The content is really quite fun to look at with both projects. And again, I apologize that video didn't quite work out as intended today, but yeah, definitely I would encourage folks to take some time looking at some of this content, because yeah, there's lots of great stuff to see. So a few other comments coming in. So around the issue of the meme photos, there are perhaps some that are labeled for reuse. So, okay. Okay, then we have another question here. Can you describe the experiences of youth who participated in the activities?
I can't quite understand that question. You mean with the surveys? When we spoke to the Inuit youth about sexual health, we made sure that they were over 18 because if they were underage, then we would need consent from the parents. So we spoke to older youth when it comes to sexual health.
Oh, and I'm seeing the question come out here. So the ones who led the activities, how did they find talking about sex afterwards and engagement with peers? So I'm not sure if this is with respect to the checkup project. So this is something that we're hoping to do with the next phase of the project. So having, as I mentioned, having young people actually lead those discussions and facilitate those community learning circles. This is not something that we have done yet for the project, but we can definitely stay in touch, and I can share perhaps with you, Linda, when those do actually take place, I can share how that experience was.
Great. Yeah, certainly. I think lots of us will be interested in seeing what else comes out of the project as it continues to unfold. So I'll just give one more moment in case anyone else has a last question that they want to slip in. Otherwise, I have just a couple housekeeping things to wrap up here. Okay, so feel free to type in a question if you like while I go ahead. But yeah, just thanks again, Sipporah, Rebecca, and everyone who came and participated in today's session. Before closing, I'd just also like to ask you to please take a minute to fill out CPHA's anonymous evaluation survey. We're really interested in your feedback to help us improve future webinars, and the survey should exit upon opening the webinar platform, or you can follow the link on the screen here. And as I mentioned, the webinar recording will be made available on CPHA's YouTube channel in the next few weeks. I'll also send out an email with the recording and with the link to the video that we could not show during the webinar today. And lastly, you can find out more about CPHA's webinar series, which this is now the end of our webinar series for this year, but you can find CPHA's resources related to reducing STBBI-related stigma at our website. You can also contact me directly at lbouchard@cpha.ca. So with that, thanks again for your participation, and have a great day.